What makes you different to other surgeons? Oh, that's another difficult question. I suppose that's probably a question for other people. Why did you decide to become an orthopaedic surgeon? I started off, my background was as an athlete. I was an athlete, a gymnast at the Institute of Sport here in Canberra. And through that, I had a lot of contact hours with physiotherapists and the sports medicine physicians. And I suppose that's when it first sparked my interest in medicine. And after I finished my sporting career, I left Canberra and went to Sydney and started studying at University of Sydney. Initially a science degree and then followed on with medicine. Initially I wanted to go into sports medicine. Once I started training, I really enjoyed the aspects of surgery, and what I liked about orthopaedic surgery was the ability to improve people's quality of life. They've got a sore joint or an injury or arthritis, and we can fix them and improve their mobility, and that really appealed to me. And that's when I headed down the path of orthopaedic surgery. How do you stay up to date with the latest advances in orthopedics? There are lots of ways we stay up to date with all the latest advances. Attending conferences, reading journals, having good working relationships with your colleagues in the industry. And I think it's very important to stay up to date with the developments in the field so that we can continue to offer the best treatments for patients and the best patient outcomes. What should people look for when finding an orthopaedic surgeon? Oh, that's a tricky one. There are a lot of things that people should look for when they're finding an orthopaedic surgeon. I think the most important thing is feeling comfortable with whomever they choose and having a good rapport with that person. And I think that's primarily the most important thing. I think we're quite lucky here in Australia and in Canberra with our craft group and our training, and I think we really punch above our weight here in terms of the delivery of healthcare services. So I think we're all well trained, and so I think the most important thing is that people are comfortable with the doctor and the surgeon and their relationship with them. What makes you different to other surgeons? Oh, that's another difficult question. There are probably similarities and differences. I think all surgeons, particularly orthopaedic surgeons, tend to have a desire to help people and have a real desire to fix things to make people's quality of life better. How am I different to other orthopaedic surgeons? I'm 10 years now down after completing my orthopaedic training, so I think I've gained a lot of experience, and traditionally I think medicine and particularly specialist care has been quite clinical, and that's what I want to change. I want to make the patient's journey and the patient's experience more personable, more relaxed and friendly, and that's what I've tried to achieve with my new practice, InMotion Orthopaedics. And so I want to sort of break that mould of specialist care being quite clinical and production line, and involve the patient more in that experience and make it as good an experience as it can be. Have you ever had an operation? No, I haven't. I've actually been blessed with pretty good health so far, touch wood. My eldest daughter, when she was very little, had a general anaesthetic for what was a relatively minor laceration or cut to her chin. And it was the scariest experience I've ever been involved with, just losing that control, and as a parent it was quite daunting. And so whilst I've never had an operation and I've not had that experience personally, I can understand the loss of control and that sense of dread that people might have going into an operation. My part, as well as doing the surgery to the best of my ability and offering treatments that are up to date, my job is to try and make that experience for people more empowering and less daunting. What's your top tip for looking after your joints? Choose your parents wisely is one tip. I think genetics certainly has an element of of how your joints will behave and what is in hold for your joints. Just having a well-balanced lifestyle, eating healthy, regular exercise and balanced exercise with low impact exercise a component, as well as some weight-bearing exercise as well. And I think starting that early in childhood and adolescence is very important for your knees as we all get older. What motivated you to open InMotion? I wanted to change the way going to see a specialist and a surgeon is for people. I wanted it to be more personable and the environment to be more relaxed and open so that people can feel free to ask questions and gather the information, because if people can get information about their treatment options, whether it's surgical or non-surgical, that is empowering for people, and that can help them feel more relaxed about their health issues and their treatment options. Tell us something we can do to avoid coming to an orthopaedic surgeon. Having a healthy, well-balanced lifestyle is very important. Eating well, regular exercise, maintaining healthy weight are all things that not only help heart health and general well-being, but can also be healthy and protective for your joints. And I think that's one of the best ways to avoid coming to see an orthopaedic surgeon. Sometimes injuries and accidents happen, and that might result in a joint injury or a fracture, and then you might need us, and we're here when that occurs. I think participating in sports or activities, making sure you've got the proper training and warm up and warm down will always help protect your joints and bones as well. What's your approach to caring for patients? I think involving the patients is the most important thing. Making sure that the patients are involved in their care and their treatment options, have an input into that, and understand what their options are for treatment. I also think communication is very important, and communicating with patients' other health practitioners, such as general practitioners, other specialists, and physiotherapists. It really is a multidisciplinary approach and a team approach, and I think that's the best way to advocate for that.